Tá muito lenta a internet.
Morgana, cadê ela? Tinha deixado aqui em cima, gente.
Deixa eu ver. Barreto@gmail. Join meeting. Yes.
Hello, Rafael.
Hello. I'm just turning off my video here. Okay. Can you hear me well?
Yes, I can hear. I can hear well. And
Can you see
can
me?
you see? Can you see me?
Yes. Your image is perfect. Your voice is perfect, and there is no delay.
Okay.
I'm going
Good.
to
My
click.
internet's very good.
Pardon?
My internet is very good.
Which internet is yours? Vivo or Net or what? What the fuck?
Is CST.
Oh, okay.
CST. Rafael has started the screen. Ah, okay, Rafael.
Can you see our article?
Yes, I see this. My article.
Your
Dr. Asshole.
Yeah. The good thing
Fucking
is sometimes if we stay with the cell phone, we are like this here.
Okay.
We could be on WhatsApp, but we are going to be like, can you see this? And so, and here it's more professional, you know. I'm still learning how to use it, but it's really, really good. So let's see here.
Where
we stop?
Stop the lecture. Maybe
lecture means palestra, the reading.
Not
the reading. A leitura.
Yes. Where is
the end of the introduction here? I'm pointing.
No, maybe patience.
Yeah, let me just check. Methods,
patience.
Trial, patience.
But okay. Patience. Okay. I can read?
Yeah, just a second here. I remember that we finished the introduction.
Okay.
We had started reading the methods.
Yes.
Let me just decrease the screen a little bit here. Yeah, the method is really, the method was really, really short. Patience. Let's start with patience here. Can you see my screen?
Yes. Can you down the page?
Scroll down. Patience.
Scroll down. Okay. I can read now.
Mhm. Okay.
Read. Are you ready?
Yes, I am. Give me a
Yes.
lecture.
Oh, it's okay. Participants were enrolled. Participants were enrolled.
Enrolled.
Enrolled is inscritos.
Inscritos ou matriculados, aham.
From August 2011 to January 2013.
Or you
And
can say
follow up.
2011 to January 2013. Both are correct.
2013, okay. 2013 or 2013, okay.
Mhm.
And follow up was completed in January 2015.
Mhm. Okay.
Então, os participantes foram inscritos foram, né, entrevistados, provavelmente, inscritos entre agosto de 2011 e janeiro de 2013, e foram seguidos, né, follow-up, e tiveram um acompanhamento completado, né, em janeiro de 2015.
Perfect.
Recruitment occurred in outpatient clinics by research coordinators if patients met the following inclusion criteria. Então, os recrutamentos ocorreram nas clínicas...
Em pacientes externos da clínica, né?
Em pacientes externos da clínica, por coordenadores de pesquisa, se os pacientes completavam, né, os critérios de inclusão.
Ou preenchiam os seguintes critérios de inclusão, né? Meet, a gente falou mais nessa parte aqui de meet, né, de encontrar, conhecer, né, mas caso preencher, né?
Preencheram os critérios de inclusão. 2 pontos. Patients who had a diagnosis of advanced glenohumeral osteoarthritis and were considered candidates for anatomic TSI after failure of non-operative treatment. Então, pacientes que tiveram diagnóstico de osteoartrite glenohumeral avançada e foram considerados candidatos para a prótese total de ombro anatômica, TSA, arthroplasty, total shoulder arthroplasty, yes. Após a falha...
shoulder arthroplasty, this one here.
Yes. Após a falha do tratamento não operatório. Ok? Tratamento não operatório, the non-operative treatment include physiotherapy, including physiotherapy, oral anti-inflammatory medication, or intra-articular corticosteroids.
So they give you a shot in your... Give a shot, dá uma injeção of corticoid.
Yes, maybe no. We can shot the corticosteroid intra-articular or intramuscle.
Okay, yeah, intramuscle. Okay.
Intramuscle. Okay.
And just a second here. Can you see I'm highlighting this word here?
Yes. Physiotherapy
or physical. 2 words. Physical therapy.
Physical therapy. Okay.
Therapy. Okay.
Patients were not...
Just a second.
Yes, I can see the highlight test.
And can you see that with Zoom, it's much better because you can have, for example, you could sometimes with Dr. Ashwal, I never Okay, you could talk to him. You could debate some procedures with him and share the same screen. So it's so nice.
So nice. I think Liz know it
Knows it.
because when I try to download this Zoom, the Zoom is already installed.
Yeah, was already installed.
No,
It's
was
very.
already installed.
This is the new Skype. There's a better version
Yes.
of Skype, and you can you can have a conference with more than 100 people here.
Yes, because Liz está tendo, is having Dale Carnage
Conference
course.
courses. Ah, okay.
Yes. And then about this time,
This is water, okay? Water.
No.
Freezing
Not,
water.
Okay, I need it. I need it. I also need it. Okay, I can continue.
Yes.
Okay, patients were not considered.
Considered. Don't pronounce the considered.
No, considered. Patients were not considered for enrollment in the presence of active joint. The presence of active joint or systemic infection. Então, pacientes que não foram considerados inscritos, aliás, pacientes que não foram inscritos na presença de
of joint or system, na presença de infecção nas juntas, né, ou sistêmica.
Isso, exatamente. Na presença de infecção sistêmica ou articular, seria.
Isso aí.
Rotator.
Nas juntas.
Rotator cuff arthropathy.
No, it's like that.
Arthropathy.
No, it's like no. What is the movement? Rotator cuff. Manguito
yes,
rotador.
Manguito rotador. Yes. Do you understand rotator cuff arthropathy?
Artroplastia. No, arthropatia do manguito rotador. I just remember the movement.
Yes. This is different. This is different of osteoarthritis.
Different
from glenohumeral osteoarthritis. Arthritis. Okay. This is different because the causes of both is different.
Are different.
Yes, are different.
Great. Next.
Okay. Muscle paralysis. Muscle paralysis. Okay. Neuropathic arthropathy. Artropatia neuropática ou paralisia muscular. Major medical illness. Ou
major means importante ou grande.
Yes. Na presença de doenças importantes médicas, né? Excluindo as doenças ortopédicas. E ele lista ali life expectancy. Minus
1 year.
Minus 1 year or unacceptable high operative risk.
My father has emphysema. He's using oxygen, and he has prostate cancer. And they want
this is a major medical illness.
And they want to operate on him, on a patient.
Probably he was not considered for this.
He wouldn't be. Ele não seria. He wouldn't be considered. And so my father has high operative risk because he may die because he
Yes.
has lots of complications.
In the shoulder is the shoulder with whatever kind of illness will not die about the shoulder.
Or die from the shoulder.
From the shoulder.
Die of or die from?
Die from. Inability to speak or read English or French. Ok? Inabilidade de falar ou ler inglês ou francês.
You wouldn't be able to participate because you can't read in French.
Yes.
But English, yes, you can.
Psychiatric illness.
Psychiatric illness
that included. Oh, what a fuck.
No. Where's our dictionaries here? Yes.
Psychiatric.
Can you see my page here?
Yes.
Here it says psychiatrist. But here it says psychiatric. English is very random.
Sorry, teacher. You should close the X videos, please.
I have a baby at home, you know. That's good. My friends were making fun these days. What are you having what are you doing in these days of quarantine? Quarantine. And he said, I've already watched everything about X videos. Quarantine.
I start to see the how can I say anão?
Dwarf, yeah. The dwarf season, yeah. You received that too?
Yes. I started the list with it's very good.
Let's go back here. So psychiatric illness that
pre-included informed consent.
See this here, pre-include
seria?
No, it's another thing here.
Preenche, impede,
exclude or prevent from,
exclude,
impedir de, okay.
Impedir de, preclude. Preclude que então uma doença psiquiátrica que possa impedir de assinar um termo de consentimento, né?
That's it.
Okay.
And
inability to be follow up for 2 years. Followed up
for the next 2 years.
For 2 years. Ou a incapacidade de ser seguido por 2 anos.
Yeah, that's it.
This trial was registered with clinicaltrials.gov. Esse estudo foi registrado with aqui não seria com, né? Seria pela.
Yeah, with maybe co or by clinicaltrials.gov. Yeah, it's a website or interventions.
Can I just a second, please. I need a mate.
Oh, really? Can you give me one? Can you give me one without coronavirus?
Okay.
So, compartilhar então. Okay. Yeah. Sure.
Oh, nice. Nice.
showing us.
It's so cute.
He's big. He's 5 months old, but he has the size of a 1-year-old kid.
He's big now.
I'm sharing the screen with him, but I just minimize the screen here. But he can see the same. If I do this here, he can see all the alterations that I do. He can see it. Okay.
Can I use the front hide self view? Oh, no.
Pardon?
Show self view. Okay, no. Can I use the front of my baby?
Oh yeah, yeah. Your baby's sleeping. Good.
Okay.
You have 4 babies for now.
4 babies.
4 babies or
2
3 or
big
4?
babies.
Good.
Interventions.
Participants were assigned.
Interventions is a kind of
Procedures like intervenções, procedimentos.
yes, yes. How these doctors
How they performed.
Okay.
Surgery.
Okay.
It's very good, Bruno, that we are trying to speak English all the time, because your course with Dr. George was just postponed, but he wasn't canceled. Just postponed, just delayed.
Just postpone. Yes.
Postponed, just delayed. But for example, if we keep on speaking English all the time, putting more vocabulary in your mind, when you I want you to get there in Canada, London, Canada, and they say, wow, Bruno, you're Brazilian, we know that your mother language is Portuguese, but your English is fucking awesome. That's
fucking awesome.
That's my goal. That's my goal.
Yes. Goal is a
objective.
Like objective.
My aim. My aim.
My aim.
My aim.
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 Aim. Okay. Let's do it. Okay.
Participants were assigned.
Participants were assigned. Were assigned. Were assigned.
Designados.
Designados.
Yeah. Encaminhados para. Yeah. Lots of
assigned.
Assigned. It's like dar, passar, distribuir, atribuir, passar, dar, encarregar, alocar, distribuir, transferir, designar. Tá? Passaram por, foram designados. Next. We're assigned to 1 or 2 subscapularis management approaches.
Yes, to 1 or 2 subscapularis management approach. Tenotomy or pill. Surgery was carried out.
This is a verb that you have to learn by heart. Carry out, realizar.
Carry out.
Realizar.
Fechado não. Fechado sim.
Surgery was carried out with the patient under general anesthesia. Anesthesia.
Carried out is
realizado.
Realizada.
Paciente sob anestesia geral, under general anesthesia. Anesthesia. Carry out is a verb that you have to memorize for the rest of your life.
For the rest of my life. Oh, my life.
For the rest of your long life.
Fucking life.
in the beach chair position, okay, like that.
Beach chair.
Okay.
Yes, beach chair position. I love it. This position.
Yeah, I love this position too. Beach chair position.
After administration of of intravenous antibiotics,
antibiotics,
and the regional block.
Bloqueio regional, you know?
It's a kind of anesthesia.
Local anesthesia.
Local anesthesia. Regional anesthesia.
Mm-hmm.
When how can I say, o braço fica anestesiado. The arm is
numb. Maybe numb.
Just the arm fica anestesiado, né?
That's numb, dormente, paralisado, paralyzed. Yeah.
Yes, paralyzed and without sensitive. Numb to, okay. Numb to.
Desensitize or
numb.
Make numb. Paralyze.
Fazer ficar dormente. Make numb.
That's it.
Make numb. Oh. The dentist numbed my mouth. Numbed.
You don't pronounce the B. Numbed. Numbed.
Numbed.
No, don't pronounce the B.
The B. Numbed.
Numbed. Numbed. My mouth. Before I began working on my teeth. Zoom is very good. You can see the screen. Everything I do here, you can see. That's really good.
That's really good.
Okay.
Carry out and make numb. Okay.
Make them. Yeah. These are words that surgery gods love.
But there are two types of anesthesia. Anesthesia in one patient: general anesthesia and the regional block. Because the regional block during 10 hours.
Okay.
And the general anesthesia just in the moment of the surgery.
Oh, really? I thought it was the opposite.
No, general anesthesia, when you use the oral tracheal tube, and you are controlled. And you are controlled.
Controlled. You are controlled.
Controlled.
Paralyzed.
Yes. And the regional block during 10-12 hours after the surgery.
Wow, that's long.
And the patient don't have doesn't have pain after the surgery.
Oh, that's good.
It's very comfort.
So a deltopector, delta is the deltoid, and pector.
Deltopector is a kind of approach. I can. Deltopector is.
Oh yeah. The video we saw. Okay.
Okay.
Because this is the deltoid and the chest.
Yes.
Okay.
It's between two muscles.
The deltoid.
Deltoid and pectoris. And a major pector. Because we have two types of pectoral. The minus pectoral and major pectoral.
Okay.
And this approach is between deltoid and pectoral. Okay? Okay for you?
Good. I'm gonna be your auxiliary.
Deltopectoral approach was used in the long head of biceps tendon and biceps tendon underwent tenodesis to the pectoralis major tendon.
Understand that?
Yes. Então, o acesso deltopeitoral foi usado e a cabeça longa do bíceps, do tendão do bíceps,
like that.
Underwent foi
Submeteu-se, underwent.
Foi
Submeteu.
submetido a uma tenodese junto ao peitoral, ao tendão do peitoral maior.
Okay.
Great.
Right.
We had two
Tendons.
Two tendons of biceps.
Biceps.
Biceps because biceps two. Okay.
Two.
The long head and the short head.
Because there are fibers. There are a group of fibers.
Yes.
Muscle fibers.
I can.
It's like.
How can I say desenhar?
Draw. I can draw. No, but
I can draw for you.
No, but I'm going to.
Yes.
Like this here.
Yes. Okay.
Like my internet here is a little bit slow.
We have two heads of biceps. Biceps. Proximal biceps, long head, or a short and long head. Okay.
Yeah. Perfect. Biceps.
We can return to the article.
Next. Only after the
subscapular tendon was confirmed to be intact on visual inspection was randomization carried out. Então, apenas depois do tendão, após o tendão subscapular ser confirmado como intacto na inspeção visual, que foi então sorteado ou randomizado para
carried out tipo assim, a escolha foi realizada. Carried out é realizado, né?
Carried out.
A randomização, o teste foi realizado.
Ok. Então, depois de confirmado que o subscapular estava inteiro, aí foi feita a randomização entre os dois tipos. Vamos fazer tenotomia ou peel. Shoulder arthroplasty implants consisted of press-fit humeral stems and either keeled or pegged, all polyethylene cement glenoids.
Oh, fuck.
Então,
There's here kill.
I can try to explain to you.
Okay.
Keeled is like quilha de navio.
Quilha.
Because the form, the draw is kind of a quilha. And peg.
Pregador, gancho. Okay.
Yes. Cavilha, exato. The form, the implant form is like cavilhas to insert the cement.
Cement glenoid.
Então, os implantes da artroplastia do ombro consistem em stems.
Stem é tronco, né? Tronco, hastes.
Isso, é uma haste, na verdade. É uma haste humeral de press fit, né? Que a gente chama, que é por pressão.
Pressiona e se encaixa, né? Press fit.
Ela é impactada com pressão. And either keeled
ou um ou outro, tá? Either ou isso ou aquilo.
Isso. Tu não coloca os dois, sempre um ou outro. All polyethylene cement glenoids. E foi colocado com cimento na glenoide. A glenoide é a articulação do ombro. É onde o húmero se encaixa.
Okay.
Glenoides. Equalis Wright Medical Group, Memphis, Tennessee, USA. Wright is a kind of uma empresa, né?
Company, yeah.
A company. Equalis is a kind of stem.
Good. All surgical procedures.
All surgical procedures were performed or directly supervised by 1 or 3 shoulder fellowship trained surgeons who were comfortable using both techniques. Então, todos os procedimentos cirúrgicos foram realizados ou diretamente supervisionados por 1 ou 3 estagiários treinados, os cirurgiões seriam residentes, tá? Seriam residentes em cirurgia do ombro, né? Que estavam confortáveis para usar ambas as técnicas. No caso ali ele citou, né? É o J.P. Warner and George fucking Astral.
Okay. Yeah.
Subscapular stenotomy was carried out with a vertical incision approximately vertical incision approximately 1 centimeter medial to the subscapular tendon insertion, leaving a cuff of tendon on the lesser tuberosity for repair.
Cuff, a gente usa também cuff é a manga da camisa, né? Cuff.
A cuff é que ele quis deixar que ele deixou uma sobra de tendão.
Isso, o punho da camisa, cuff.
Para poder suturar depois.
Punho da manga, bainha, punho, algemas, algemar. Tapa. Aí já verbo, né? Cuff. É uma bainha, uma sobra, punho, bainha.
Yes. Bainha seria bom. Então, a tenotomia do subescapular foi realizada com uma incisão vertical, aproximadamente 1 centímetro medial ao tendão do subescapular, deixando uma bainha de tendão na tuberosidade menor para o reparo. The repair consisted of a multiple side-to-side interrupted mattress stitches using high-strength branded number 2 fiber suture. Então, o reparo consistiu em múltiplos e ininterruptos pontos lado a lado de
mattress é colchão, né? Stitches é ponto. O que tem a ver com ponto e colchão?
Mattress is a kind of stitches.
Pois é, mattress stitches. Tem a ver com alguma coisa acolchoada, alguma coisa assim?
É como uma sutura de colchão, que eles chamam, né?
Ah, tá. Colchão de ar, colchão, capa acolchoada, colchão.
É uma sutura.
Okay, no problem. But you understood? Yeah, I'm trying to.
Yeah, it's very simple. When you switch a side to side, it's a very simple stitch.
Okay. Okay. Tá. Okay. Got it. Something like that here.
Yes.
Something like that.
Matrix stitch. It's side to side.
Suture. Like this here. Yeah, it's like that. Next. Using high strength, usando de alta força. Braided quer dizer trançado.
Using high strength number 2 fiber suture. Fiber is a kind of suture. It's a kind of how can I say fio de sutura?
Thread suture. Que wire. Wire
yes.
É tudo de luz, tá? Então sei.
Yes. Fiber wire.
Suture.
Fiber wire.
Suture thread type. Suture types. And thread.
Is a kind fiber. Fiber wire.
A thread. Thread é tipo o fio de sutura. surgical sutures.
Right fiber wire.
Fiber.
Fiber
Fiber
wire, yes. Fiber wire suture.
Ah, tá. Aí já é.
Suture. Âncoras and fios cirúrgicos. Yes, fiber wire. Yes.
Okay.
It's a very straight wire.
Okay.
Because this my fingers
are cut.
Are cut.
You use it a lot.
Because when I try to apertar, né? To apertar o nó.
To hold it.
When I hold it,
press the knot, or to pull.
Press the knot.
Or pull the knot.
My fingers hurts.
Yeah, it almost cut your finger.
Yeah, cut my fingers. In addition, to augment the side-to-side repair, 3 horizontal mattress stitches branded number 2 fiber suture were placed in the medial aspect of the subscapular sternum, passed through 4 drill holes in the intertubercular groove, and tied over a mini plate over the greater tuberosity. Oh.
Além disso, aumentar o reparo lado a lado.
Para aumentar o reparo lateral, seria 3 pontos matres horizontais com fio Sutura number 2.
Braided é trançado, né?
Foram trançados. Were placed,
foram colocados
no aspecto medial do tendão subescapular,
passando aspecto lado, aresta, lado, só superfície.
Ah, sim. Na superfície medial, então.
Subescapular.
Passando através de 4 perfurações.
Drill holes. Drill é uma furadeira.
Drill é furadeira, seria. Drill holes.
In the
intertubercular groove.
Okay. Groove has lots of meanings. In this case here.
In this case, sulco. Yes. In this case, sulco. Sulco intertubercular. The sulco intertubercular is where the long cable bicycles head pass. Okay. And tied, e foram atados sobre uma mini plate over the great tuberosity.
Mini placa.
Mini placa over the great tuberosity. Sobre. Figura 1. Clica na figura 1.
É só clicar aqui já vai.
Yes, it's a kind of a mini plate in gray.
Next.
Okay. For the subscapular spill approach, this is tenotomy. Is for the subscapular spills approach, the tendon was completely released from the lesser tuberosity. Ele foi para o
Abordagem.
acesso, para abordagem do subescapular, para descascar o subescapular, o tendão foi completamente solto, né?
Liberado, solto,
Liberado da tuberosidade menor. Repair consists of 3 high tensile strength horizontal mattress stitches placed in the subscapular tendon. Então, o reparo consistiu em três pontos matriz horizontais de alta tensão e força.
Força horizontal.
Placed in the subscapular, colocados no tendão subescapular, né, passados, né, pelo tendão subescapular, através de 4 drill holes, através de 3 perfurações ósseas, né? Na goteira intertubercular groove, and tied over a mini plate over the greater tuberosity, e também atados acima de uma mini placa acima da grande tuberosidade. Additional interrupt mattress sutures were placed across the lateral subscapular tendon to tissue along the lateral aspect of the bicipital groove. Aspect of the bicipital groove. Bicipital groove. Então, em adição, e além disso,
adicionais interrompidas suturas foram colocadas ao longo.
Interrompidas seria ininterruptas, seria.
Por exemplo, tá ali, interrupted mattress sutures. Mas seria literalmente adicionais interrompidas suturas, mas foram interrupted, mas interrompidas. Tipo, certo que tem um tipo aqui, ó.
Interrupted.
Aqui. Talvez aqui alguma coisa que tenha interrompido. Essa estrutura deve estar interrompida de repente, sei lá. Foi feito um ponto, sei lá, que é interrupted. Ok. Foram colocados ao longo do tendão subescapular lateral.
Cross é ao longo, né?
Ao longo,
Ao longo da porção lateral do tendão. To tissue seria para...
Tissue é tipo assim, ligar, né? Tissue é tecido, né? Mas tipo, para ligar, conectar, tipo, remendar.
Tissue.
Lenço, tecido, pano. Tá, e aí tem
cicatriz ali, ó.
Aqui não vai ter como verbo, né? Mas tipo, tecido. Tipo como remendar. Ó,
tecido cicatrizado, scar tissue, muscle tissue.
Tecido conjuntivo. Bathroom tissue. Toilet paper, no inglês americano. Toilet paper. Tá, mas tipo assim, para ligar, remendar, cobrir.
To tissue along the lateral aspect of bicipital groove. Bicipital groove. Ok. Post-operative care and physiotherapy were identical in both groups. Então, os cuidados pós-operatórios e a fisioterapia foram idênticos em ambos os grupos. Patients receive 24 hours of prophylactic antibiotic coverage. Então, os pacientes receberam por 24 horas antibióticos profiláticos para cobertura, né? A shoulder sling, então uma tipóia para o ombro, was worn for the first 6 weeks.
Passou de wear, vestir, usar, né? Foi usada.
Então foi usada, worn. Worn é o passado, worn é o passado de wear.
Wear. Aí fica wear de vestir, worn. Tá? Wear, worn. Vestir, vestir.
Worn. Passado particípio.
Worn.
Foi usado, então, né? Então, a shoulder sling was worn for the first 6 weeks. Foi usado durante as primeiras 6 semanas. Self-assisted for elevation. Então,
forward elevation.
Forward elevation. Então, self-assisted seria
autoassistida, elevação para frente.
Autoassistido. Isso. Autoassistido é quando eu auxilio a elevação. Meu outro braço, auto-assisted, né?
Elevação para frente, forward é para frente. Né?
Self-assisted. Activity seria sozinho. Self-assisted. Ok?
Active
when we can do it alone without auxiliary.
We say by yourself. Alone é sozinho, mas é mais tipo sozinho, sem ajuda, tu fala by yourself.
By yourself, ok. By yourself. Self-assisted forward elevation was permitted the first operative day to a maximum of 90 degrees, and self-assisted external rotation was limited to the neutral for the first neutral for the first 6 weeks. E também the o exercício self-assisted, né, da rotação externa. Rotação externa foi limitada do neutro até o neutro.
Pelas primeiras 6 semanas.
Isso, a posição do ombro é assim, na tipóia, e a rotação externa até o neutro é aqui. 0 graus. Ó. Até o neutro. Ok? Patients were instructed to carry out exercise with the contralateral arm. Os pacientes foram instruídos a realizar exercícios com o braço contralateral. By guiding the operating arm through, by guiding the operating arm through the exercise while maintaining the operating arm in a relaxed state. Então, os pacientes foram instruídos a realizar exercícios com o braço contralateral, guiando o braço operado para o exercício.
Pelo exercício, através do exercício.
Enquanto mantinham o braço operado numa posição relaxada, no estado relaxado. They were instructed to carry out all exercise in the supine position. Então, eles foram instruídos a realizar todos os exercícios na posição supina, no caso deitada. Tá? Patients were generally discharged home by day 1 and continue their rehabilitation program as outpatients. Então, os pacientes deram alta, em geral, para casa no primeiro dia e continuaram a sua reabilitação, programa de reabilitação as outpatients, seria com pacientes externos, né?
Só que é supine
position. Supine. Active range
Do you
of
like
motion.
supine?
Supine.
That's a joke. Continue. Patients were generally.
The quarantine made you crazy, man.
Yeah. What is discharged? Patients were generally discharged home by day one discharge.
Discharge. This in Brazil. In Portuguese. In Portuguese, you can say dar alta, né?
Descartado, okay? And baixar o hospital, we say?
Baixar o hospital.
Be
undergoing.
admitted. Be admitted. Be admitted and be discharged. Ser descartado.
Be admitted.
Né? Be admitted, ser internado. And be discharged, ser liberado.
Yes. Active range of motion was initiated at 6 weeks, which coincided with sling removal. Então, os movimentos ativos.
Range é amplitude, né?
A amplitude de movimento ativo. Então, os movimentos ativos, quando sozinho eu vou fazer, foram incentivados, iniciados at 6 weeks, após 6 semanas. Tá? Which que coincide com a remoção da tipóia. Ok? At 12 weeks post-operatively, gentle strengthening exercise were introduced. Were introduced. Então, na 12ª semana de pós-operatório, exercícios de força gentle.
Literalmente assim, suaves, né? Gentis, suaves. Exercícios
gentis de força foram introduzidos, né?
Exercícios de fortalecimento foram introduzidos, né?
Ok.
What is outcomes?
Outcomes. Resultados.
Resultados, good.
Ok. Ok.
Outcomes.
Given the nature of the surgical trial, it was not possible to blind the surgeon to the surgical intervention. Então,
dada a natureza do teste cirúrgico, não foi possível cegar o cirurgião para a intervenção cirúrgica. Tipo que ele soube quem era o paciente, é isso? É isso?
It's difficult to the surgeon make a surgery and not knowing the case or not knowing the patient. Trained research assistants carry out follow-up.
Ou não estende esse E, né? Trained. O ED não pronuncia o D. Trained
research assistant carry out follow-up assessments and were blinded to the surgical procedure. Então, assistentes da pesquisa
treinados, né?
Treinados, né?
Na pesquisa,
Assistentes de pesquisa treinados realizaram o segmento, os questionários de segmento,
avaliações, assessments,
avaliações de segmentos
de acompanhamento,
e foram blindados, né? Foram
cegados ao procedimento cirúrgico.
Então quem who assessed the follow-up were blind.
It means that he
blind.
didn't know the patient.
He didn't know the patient, but
Or
the surgeon.
procedure.
But the surgeon is impossible.
Mhm.
Okay.
Okay. Assessors.
Assessors did not have access
Access.
to the patient chart prior to the evolution.
What is chart? Chart.
I don't know.
Prontuário. Chart é o quadro. Quadro. Então, os assessores não tiveram acesso ao prontuário do paciente anteriormente à avaliação. Prior é previamente, né? Prior to the evaluation. The patient was blinded to the subscapularis management group allocation.
The patient was blind to the subscapular management. Aí o paciente também não sabia.
Foi cegado, né, pelo manejo subscapular da locação em grupo. Tipo, ele não sabia exatamente em qual grupo
o paciente não sabia qual a técnica que ia ser usada. Quem fez os questionários e pesquisou isso também não sabia.
Uhum.
Quem sabia era o cirurgião. Bom.
Yes. The primary outcome.
The primary outcome for the study.
Tá voltando aqui.
Opa. The primary outcome for the study. Então, o resultado principal do estudo was internal rotation strain in the belly press position. Foi a força de rotação interna na posição de belly press, né, que é um teste específico para a pesquisa de força da rotação interna. Measured with an electronic measured with an electronic handheld dynamometer.
Uhum.
Então foi medido com um
dinamômetro, né?
Dinamômetro de mão.
De mão, sim. A gente viu isso aqui.
Portátil. Portátil. With electronic, um dinamômetro eletrônico portátil. Aí ele coloca a marca ali do dinamômetro. MF2 Hogan Health Industries West handheld dynamometer, Jordan, Utah, USA. Okay, this method
has been validated
for use in a subscapular evolution. Então esse método foi validado para usar na avaliação subscapular.
Uhum. The patient's hand was placed.
Evaluation.
E assessment, there are synonyms.
Assessment and evaluation is the same?
Are synonyms.
Synonyms. The patient's hand was placed over the lower sternum with the elbow in line with, but not posterior to the wrist. Então, a mão do paciente foi colocada sobre a parte inferior do externo, com o cotovelo em linha com ele, alinhado, em linha com, mas não posterior ao punho. Ok? A accuracy, the test accuracy.
Aquela vírgula não precisaria ter existido ali. Foi um erro de digitação.
Great teacher. What comma?
Posterior to the wrist. Não precisa aquela vírgula ali, né?
But not posterior to
the wrist.
The wrist.
That comma is misplaced. Shouldn't be there.
No. With the elbow in line with the wrist.
Okay. But not posterior to the wrist. Okay. In line with the wrist. Um aposto, okay.
In line with the wrist, yes.
Action for me, okay. It's correct. Sorry.
Test accuracy for the diagnosis of full thickness tears. Então,
Tears
a acurácia do teste para diagnósticos de lesões completas,
Tá, olha
rupturas
só.
completas, né?
Tear literalmente rasgão, né? Então, e full thickness é grossura, espessura plena dos rasgões.
De espessura completa. Então, é uma ruptura de espessura completa.
Se tu pronuncia tear é lágrima. E se pronuncia tear, é rasgão, ruptura.
Tear, yes.
Ah.
Tear. Rotator cuff tear.
Tá.
Ok.
Lá em cima.
A full thickness tears has.
Aí lá em cima, again.
Has
been
reported as follows. Então,
foi relatada como segue. As follows.
Como segue. Então, ó, sensitivity ranging from 57% to 100%. Specificity 57% to 88%. Positive predictive value 57% to 75%. And negative percent. And negative predictive value 83% to 91%. Então, a sensibilidade ranging oscilou, seria?
Então, o alcance, né, de sensibilidade ranging é o alcance de sensibilidade de 57%.
O alcance de sensibilidade foi de 57% a 100%.
Amplitude, né, alcance.
Do you know the difference from sensitivity and specificity?
No, I don't.
The sensitive, a sensibilidade, né? Qual é o potencial do exame de rastrear pessoas doentes? Tá? E a especificidade é quando tu, dentre as pessoas doentes, tu consegue com um teste ser positivo ou negativo. Tu entendeu? Por exemplo, a mamografia para rastreio de doenças da mama é um exame altamente sensível. Então, todos os exames que são altamente sensíveis são bons para rastreio. Para rastrear doenças. Em saúde pública, isso é importante. Quanto mais sensível o meu teste, mais eu tenho a chance de encontrar pacientes doentes. Por isso que é bom fazer mamografia ou exame de toque em pacientes acima de 50 anos. Não adianta eu fazer mamografia em pacientes de 15 anos. Porque ele vai ser pouco sensível.
Sim.
E testes que tenha alta especificidade é aquele teste que, dentre as pessoas doentes, aquelas que eu vou realmente diagnosticar. Então, é a importância disso. Ok?
Great. E valor preditivo positivo, né? Positive predictive value, valor preditivo positivo.
Valor e o valor preditivo positivo é quando eu encontrei a doença, daqueles que eu encontrei a doença, qual é a chance de aquele resultado realmente ser positivo. E o outro é qual é a chance daquele resultado ser negativo.
Nice.
O positive predictive value está linkado com a sensibilidade e o negative predictive value está linkado com a especificidade. Então, ali ele está dizendo assim, é um teste que ele tem boa acessibilidade, de 57 a 100%. É meio, tu vê, de 50 a 100%. Não dá para dizer que é um bom teste.
Uhum.
Tá? E a especificidade também, 57 a 88. E daqueles que testaram, tiveram positivo, a chance deles serem positivos mesmo é entre 57 e 75. E daqueles que testaram negativo, daqueles que o resultado deu negativo, a chance de ser negativo é entre 83 e 91.
Uhum.
Tá?
Great.
Absolute strength was recorded in the patient's arm position. Então, a força absoluta foi gravada.
Ou registrada.
Ou registrada. E a posição do braço do paciente, elbow in line with or posterior to wrist, foi documentado. Was documented.
Uhum.
This method of evaluation of the subscapulars after shoulder arthroplasty has been used in a prior study.
Uhum.
Então, esse método de avaliação do subscapular após a artroplastia de ombro foi usado
em um estudo prévio.
Em estudo prévio.
Okay, Bruno, what's your how was the experience of having this online class through Zoom, through this software Zoom?
For me, it is a great experience about this method to our class. I can hear I can hear you very well.
Mm-hmm.
And it's not delayed.
It's not delayed.
But it's not delayed because the internet is very good. Mm-hmm. But I can't see your mouth, and the pronunciation is very good to see when the teacher or other people speaking, because you can hear and see the movement, the mouth. Mm-hmm. And yes, it's very good because
now you can strength.
Okay, strength. But it's very, very good auxiliary to in this moment, in this the pandemic.
But do you think you, for example, do you think you learned less like this, for example?
No, I think I study and learn very well. Mm-hmm. Eu não consigo, né? Eu não consigo ver que eu perdi algo.
Yeah, that's good. At least for the moment we are living now, it's great. Because if I were using my cell phone, okay, or you would leave like this, but my hands are free because I don't need to. Okay, I can put my cell phone here or put my cell phone on the screen like that here, like I'm doing here. But my hands are free, and then I can shift, I can switch screens and show you, for example, the other dictionaries or other things,
or other pages or or article.
Yeah, and
or
so
X videos,
and so that's it. So we can have fun and learn at the same time. Okay.
For me, it's very good. Congratulations for your patience and or your pleasure to teach and we
Namaste.
to teach your your classmates, no, your
students.
students. I think you try again with me and other students, and I can speak I can speak in the media, social media, about this experience with you, and you can use this to show to to other students. For
Yeah.
me, it's very, very, very good.
And the good thing is that this class, Bruno, is being recorded. Can you see here, recording?
Mm.
Okay, so if you, for example, I didn't understand exactly what Rafael said, that part, etc. It's gonna be recorded in my computer. I think it's gonna be recorded. Hello, it's gonna be recorded in my computer, and then you can watch it again. It's really, really good because sometimes
Okay.
on a presential class,
Record. It's
recording.
very good. Recording.
Yeah. So the good
Okay.
things that you can watch again.
Do you know? Do you know when my book is arrived?
Actually, there is a book. There lots of materials arrived this week. I think maybe there is one I can give to you now because some students are slower than you.
Okay.
Maybe I'm just going to analyze it, and then next week I'll let you know. Okay.
Okay.
But would you like
Thank
to
you.
finish this article next week?
Sure.
Okay. But this one we're going to.
For me, is very good, teacher. Thank you so much, and take care with
Thanks.
you and with our family.
Yeah.
Of your family.
We're gonna stay home.
Stay home, please.
Stay home for the kids. There's a song.
For the kids. Yes.
The song. Stay home for the kids. Yeah, and so
Okay.
because we think it's going to last until next week, but people are saying that the estimate or the prediction is that this pandemic, may last until April or more. So that's the problem. So
for me, this kind of class is very good for the moment.
And I'm going to, for example, transitions one. I'm going to install this in my computer here, and you are going to. I'm going to share the screen with you, and you are going to see the digital material and everything here in my computer. So that's great.
Yes, the audios and videos we can hear and see.
Yeah, that's it. Because I'm gonna share the screen with you. It's perfect.
Thanks God.
Technology. That's technology.
Technology. Okay.
We're living crazy times, but
for now you can close your physical school.
It's closed actually. It's closed.
Then you never you never need to pay the how can I say, the rent?
Yeah, the rent or the infrastructure.
Yes.
Yeah. I don't have to clean it anymore, and so.
Oh, okay.
To paint the walls or other things.
Think about that.
Yeah.
Because there are many kinds of classes in the internet.
On the internet
with
like this.
On the internet with very good teachers.
Yeah.
And you are a very good teacher.
And
you should use the internet to your favor.
Of course. And the world is changing.
And the world changing. Yeah. Okay. I think the class with all students and in a big class is very good, because is the contact with students is very important. But the world changing, and
the world is changing. Yeah,
the world is changing. Yeah.
Someday it's a good thing that, for example, oh, how I'm tired, it's raining a lot, I don't wanna, for example, you are my private student, and so you can say, ah, but it's so cold, it's raining a lot, my car broke down, I have a cold, I would like to leave home, can we have an online class today? Yes, we can.
Yes, we can. Yes. Thank you, Rafael.
Okay.
Good night for you and your family. Nice, your babe. Your baby is very, very nice.
Thank you. Bye-bye.
Bye-bye.
Thank you. Bye. See you. Our next class is gonna be on Monday.
On Monday. On
the
Monday.
Same time? At the same time?
I don't know. I don't know because probably I have surgery.
Take care.
But
some mask.
Yes, but I speak.
I'll let you know. Say, I'll let you know.
I'll let you know.
You know.
Eu farei você saber. I let you know.
I'll let you know. Vou te dizer. I'll let you know. Okay? Bye-bye. See you.
Bye-bye.
Bye.
Lead meeting.